Good afternoon. We're coming on the air this afternoon because Governor Ducey is giving a now daily update on the coronavirus situation in Arizona. Here's the governor speaking from the state lab.
Since we last briefed you, Arizona's made significant progress towards implementing measures to increase capacity in our healthcare system, build PPE supplies and critical resources, and reduce the strain on distribution chain for our local grocers. We've also seen firsthand the impact of COVID-19 with 2 Arizona lives lost to this virus. Our hearts go out to them and their families. It's a sobering indication of what we will likely continue to face. The sad reality is, just like the rest of the country, we expect more deaths. And as we work to increase testing capacity, we expect more confirmed cases. But we aren't standing by idle. We're working around the clock 24/7. Health professionals, education leaders, workforce policy experts, the public sector, the private sector, the National Guard, operations, and logistical strategists, doing all we can to minimize the spread and maximize our fight against this deadly virus. We're making progress, and we want to share the latest with you today. Now, our actions to date have been on March 11th, I declared a public health emergency. And in our efforts to reduce the spread and flatten the curve, last week I issued an executive order prohibiting dine-in services at restaurants and bars and closing movie theaters and gyms. We've worked closely with Superintendent of Public Instruction, Kathy Hoffman, to securely close our schools with a priority to minimize the impacts on our students and teachers. And to keep our seniors safe and healthy, we took a step to ensure they limited their exposure, delaying expiration dates on driver's licenses so our elderly population doesn't have to visit the MVD. We've halted in-person visitation in state prisons at the Arizona Department of Corrections, Recidivism, and Reentry, and expanded telework for employees across state government, with exceptions for critical positions like our corrections officers, state troopers, and DCS caseworkers. At the Department of Economic Security, we've pledged to continue payment to child care providers during this difficult time, enabling continued care and alleviating the cost burden for low-income families during these uncertain times. At Access, we've received approval on an 1135 waiver from the Centers for Medicare and Medicaid Services to protect against any disruption of care for its members during this public health emergency. We've taken aggressive action to preserve medical supplies and PPE by suspending elective surgeries to free up vital resources, gloves, gowns, masks, and ventilators, increasing capacity in our healthcare system. And we've activated the Arizona National Guard to provide relief in our food distribution chain, stocking shelves in our grocery stores and allowing Arizonans to have reliable access to food and resources, and fill their pantries and refrigerators responsibly. We're working hand in hand with the federal government through the CDC, NIH, HHS, and FEMA. This morning I joined a video teleconference with Vice President Pence, administration officials, leaders in the federal government, and subject matter experts, and the state's governors, where they indicated additional guidance will be provided by the CDC later today. This weekend I was on site for the delivery of our state share of the strategic national supplies we had ordered, and they were delivered this weekend. Arizona was the first in our FEMA region to receive this much-needed inventory. I'm grateful to everyone on site for their assistance in breaking down the resources for distribution across all 15 of our counties and to those who need it most with priority. It was an overwhelming amount of resources, but still, it's not enough. As we've seen, commercial partners are looking to build capacity for testing, with Banner Health standing up 4 drive-through testing sites today and more to come. To guarantee our public health experts get the data they need to accurately model the spread and plan ahead, today I'm issuing an executive order for enhanced surveillance, requiring commercial labs to provide laboratory specimens for in-depth analysis and sequencing. It will also require commercial labs to provide denominator data on their testing, something that to this point has been provided voluntarily by our commercial lab partners. For more on COVID-19 cases in Arizona, updates on testing, resources, and healthcare capacity, I'm going to hand it over to Dr. Kara Christ. Doctor?
Thank you, Governor. Across the country and the world, we've seen the devastating impacts this virus has on our communities. And in Arizona, we're faced with the all too real reminder that COVID-19 is a highly contagious, serious, and in some cases, fatal disease. Here are the latest figures related to COVID-19 in Arizona. Today, we have 234 cases in 11 counties throughout the state. There are 139 cases in Maricopa County, 25 in Navajo, 24 in Pima, 17 in Pinal, 17 in Coconino, 3 in Yavapai, 4 in Apache, 2 in Graham, 1 in Yuma, 1 in Cochise, and 1 in Santa Cruz. Tragically, we've seen 2 lives lost to COVID-19, and our deepest sympathy is with the families and friends of these Arizonans. Over the last few weeks, we've continued to see the numbers climb, and we expect greater increases moving forward. Arizona has community spread of COVID-19, and as testing capacity increases, we know we will find more cases. We've taken aggressive action to follow CDC guidance to combat the spread, including the governor's executive order to prohibit dine-in service and close all bars, movie theaters, and gyms in areas of community spread. While testing capacity has increased, we continue to face the national shortage of testing supplies and reagents. At this time, there simply aren't enough tests for everyone who wants one, so we continue to prioritize our high-risk populations. To be clear, testing will not change your treatment. If you have mild flu-like symptoms, stay home when you are sick and for 72 hours after your symptoms go away. Seek emergency care if you have extreme difficulty breathing, constant pain or pressure in your chest, severe constant dizziness, or other serious, concerning, or worsening symptoms. Our work with commercial partners to expand testing availability is still ongoing. Under a standing order that I've issued for the state, commercial partners like Banner are standing up drive-through testing facilities. As Governor Ducey detailed, we've made a number of steps designed to decrease the spread, and I'd now like to provide you with details on what we're doing to increase capacity in our healthcare system. In addition to the governor's executive order halting elective surgeries in an effort to preserve personal protective equipment, ventilators, and other critical medical resources, we're working around the clock to secure resources in our hospitals. In the last few days alone, we took in a portion of the state's strategic national stockpile, including 244,000 surgical masks, 60,900 N95 masks, 50,000 latex gloves, 26,208 face shields, 22,000 surgical gowns, and other critical resources. And we've already placed the order for the next portion of Arizona's strategic national stockpile supplies. On Saturday, our request to HHS for 5,000 ventilators moved towards the next step of approval. And earlier today, the FDA released guidance to safely convert anesthesiology devices used in outpatient procedures to ventilators that can effectively treat those infected with COVID-19. We're engaging in a statewide survey of our ambulatory surgical centers to identify these devices and build overall capacity of ventilators and PPE. Over the weekend, we've been working with private and commercial partners to secure up to 2 million N95 masks, 1 million surgical masks, and 1 million surgical gowns, with 260,000 of these N95s anticipated to be in Arizona next week. We're exploring temporary waivers with the medical board to allow retired physicians to be quickly relicensed. This will help us build capacity in telemedicine to reduce our exposures in hospitals and healthcare facilities. And we're implementing measures for EMT professionals to reduce hospital burden, including screening measures and the ability to provide expanded services to those in need. In terms of hospital resources, we must continue to increase our bed capacity. Currently, there are 16,905 licensed hospital beds in Arizona and 1,532 ICU licensed beds. The estimated need is rapidly evolving as we gather new data, with a potential surge of COVID-19 patients above and beyond our current capacity of beds. The governor's executive order to implement enhanced surveillance for information related to COVID-19 will assist greatly, providing awareness of our hospital capacity and surge, allowing us to get denominator data on commercial laboratory testing, and collect laboratory specimens to do further analysis and sequencing. Arizona has a plan for increasing our healthcare capacity, and we will continue working with hospitals to identify ways to increase their internal capacity, including the use of triage tents outside of emergency departments, utilizing hospital rooms, recovery areas, and other unused portions of hospitals to provide additional beds, and working with hospitals on any waiver requests they may need in order to increase their internal capacity. We're also working on utilizing alternate care sites to provide additional capacity beyond the hospital, including reactivating pre-existing hospital sites such as St. Luke's Hospital, Core Institute Specialty Hospital, and Scottsdale Liberty Hospital to add beds, utilizing non-traditional facilities such as ambulatory surgical centers and respiratory training facilities to provide additional ICU care, and using large venues such as the Coliseum to provide step-down or recovery care for those who are ready to leave the hospital but unable to go home. And we're working with DEMA to request additional federal resources, including 3 field hospitals, 2 for Phoenix and 1 for Tucson. These efforts are just a fraction of the work put in by my team at the Health Emergency Operations Center and the support from Wendy Smith-Reeve and the team at the State Emergency Operations Center to build capacity in our healthcare system. As a public health professional, I want to take a moment to address the very real mental health impacts our citizens face in light of these recent events. Whether it's nutritional impacts for our children who are out of school, the fear in our high-risk populations, and the anxiety of those who just miss hugging their parents and grandparents. It's important that we not mistake the responsible practice of social distancing to mean encouragement of emotional distancing and isolation. Remember, everyone deals with stress and anxiety differently. During these difficult times, everyone could use a little extra compassion and kindness. And finally, I know some of you chuckle as I repeat these lines, but they really are so important to ensure we reduce the spread in Arizona. Wash your hands often with soap and water or used an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. And if you are sick, please stay home. Cover your cough or sneeze with a tissue and immediately throw that tissue in the trash. Clean and disinfect frequently touched objects and surfaces. And if you need to see a healthcare provider, consider using telemedicine. Stay home whenever possible and avoid crowds of 10 or more people. It is best to keep 6 feet between you and others when you are in public. Avoid social visits, shopping trips, and discretionary travel. Do not visit nursing homes or long-term care facilities unless you are providing critical assistance. And practice social distancing everywhere. With that, I'll hand it back to Governor Ducey.
Thank you, Dr. Christ, for the work you and your team have done to preserve public health and prepare for what's to come. I also want to say a big thank you and shout out to Wendy Smith-Reeve with the Division of Emergency Management and General Mick McGuire with the Arizona National Guard. I'm grateful for their commitment and leadership and the work of your dedicated teams working together to combat COVID-19. Many of you have asked if or when the state will move towards a stay-at-home policy. The answer is not at this time. We're following the facts related specifically to the state of Arizona. The CDC isn't there yet. Arizona is not there yet. We're not at the same stage as other states. And today, on a call with the state's governors from around the country, the Vice President made it clear there have been no discussions about a nationwide lockdown by the President's coronavirus task force. As I travel around the state, it's obvious that citizens around the state are already staying at home and acting responsibly. There's empty streets and empty sidewalks and traffic-free highways. But we all know the risks. The virus is most harmful to those we love the most, our grandparents and our parents. All of us should heed the advice of public health officials. These are unprecedented times, and our approach has been to proceed with a calm and steady manner and with a sense of urgency, and to provide certainty wherever possible. To that end, today I'm issuing another executive order for the employers, families, and citizens across the state that details what are essential services. Again, we are not implementing a so-called shelter-in-place policy as other states have done. This is a proactive and administrative measure that ensures that the state has one consistent, overarching policy that is based on CDC and public health guidance so that the people of Arizona across all jurisdictions, cities, and counties have clarity and consistency. It's my hope that we stop the spread, protect our economy, and mitigate the need for further action. But this order will allow workers and employers to responsibly plan for what things look like in the weeks ahead. We've had to make some tough decisions designed to protect public health, decisions that have been tough for our workforce, small business owners, and families. I want to thank all Arizonans for their cooperation during this time. We know this is creating economic challenges, and they are ones that we will be addressing in the days, weeks, and months ahead. Our commitment to Arizona is twofold: protecting public health and our economy. We're all in on both.